Thank you so much. Thank you. Good morning, everybody. I would like to first of all thank Dr. Prakash and
Please clear it to 10 minutes, not 8 minutes. Timer.
and Professor Malik for inviting me for this wonderful session. And also a special thanks to Professor Sunaina Malik for giving me a topic for which I really had to scratch a brain and prepare an absolutely brand new talk. So I have modified it a little bit. So because these are absolutely new topics. So just to give a background, what I learned as I accumulated this knowledge as to what is artificial intelligence, why it is being talked about so much, what is its role in a healthcare in general, where it has been used so far in eye care, and then we'll come to how it can be used or it's being used in cortical vision impairment. Because in CVI, the artificial intelligence is something which is evolving, and they are right now gathering a lot of data about how it can be made available to people. So let's dig in and see where we take this. So this is a headline of the New York Times around a decade ago. And this is from the game Jeopardy, where Ken and Brad, two of the participants, was defeated by a participant called Watson. The only difference, though, here was that Watson was not a person, but was a machine or what we call an AI. So an AI-driven machine defeated two seasoned players of Jeopardy, and that became a headline in New York Times a decade ago. This particular program of machine learning or artificial intelligence, as we call it now, was developed by IBM. IBM Watson was used for multiple, or is being used for multiple different facets of life. In healthcare, it made its entry with oncology, general oncology. It was, in fact, IBM Watson had that whole consortium had a tie-up with MD Anderson Oncology Hospital in Texas, and they tried using IBM Watson to first predict where a particular patient will go and what would be the best form of treatment, chemotherapy, radiotherapy, surgery, combination of all this. And it was fed a lot of data from all over the world. And it worked as far as science was concerned. It was giving a good amount of adjunct data to the physician, the treating physician and oncosurgeons as to how a particular, it was able to predict as to how a particular patient will behave 2 years from now, 3 years from now, 4 years from now. Of course, it didn't realize its potential because of the more of a logistic and a commercial angle. And last few years, it has been, now it is not being used in oncology, but it surely gave us an insight as to what a machine learning artificial intelligence can do in healthcare, how it can help us with the decision making and even designing a treatment plan. So why at all? Why we are looking at artificial intelligence and why we are not really relying on RI, what is known as RI or real intelligence? And there was a paper which we published in IJO in 2019. It was a commentary to a paper which was published earlier, and there we said that artificial, and the commentary was in response to use of AI in diabetic retinopathy. So the reason AI is being looked at is especially in countries like India, where we may not have a trained health personnel in remote areas to look for, let's say, problems like diabetic retinopathy or glaucoma, the posterior segment evaluation. We not have the trained personnel on ground. And that's where there is an anticipation that that's where the second epidemic of lifestyle-related disease like diabetic retinopathy and glaucoma is going to hit. So how do we make sure that we screen, we take care of these patients early in the disease so that they remain healthy? And it also has an implication of reducing economic burden because of disability to the nation. So to solve this problem of access to healthcare in remote area, AI can be of great help. And as we saw in the case of IBM Watson, because of algorithmic approach, it can be used as an adjunct to diagnosis and prognostication of a complex diseases, because it is over a period of time when the data is fed, it probably can think ahead better than a human brain can do. At least that's what the anticipation is. That's the reason why AI is being looked at in eye care and healthcare. Now, how does it work? How does an artificial intelligence, how does it work? And again, we had worked on it. I had worked with scientists from IIT Madras when I was in Chennai in 2010-11, and we published this paper in one of the reputed engineering society journal in 2015. What we had done was we had worked on finding hemorrhages and then a neovascularization in patients with diabetic retinopathy. Can a machine tell us with reasonable accuracy about the presence of hemorrhage or presence of neovascularization looking at a fundus image? So what was done, how it works in most instances is that you feed a lot of normal data in thousands. So in this case, fundus images to the software. Software then learns as to what a normal looks like. And then it starts telling you that this is not normal, this is not normal. And then again, it is fed with the data which has, for example, in this case, neovascularization or hemorrhages. And then it learns to detect, first it learns to detect an abnormal red dots. Then it learns to differentiate between, let's say, microaneurysm, hemorrhage, and neovascularization. And all this happens because there is a constant input of data. It learns what you want it to learn. So initial period of artificial intelligence is completely driven by what you want the machine or that intelligence to learn. So you give the input of whatever data, and in this case, images. The machine keeps learning, saying what is new, what is normal, and how the deviation of normal can be represented in an image, and what is the deviation. And that's how it runs. And in the software which was designed by us at that time, had a reasonable accuracy of about 90% of detecting an abnormal fundal images, and a reasonable accuracy of even telling us that what that abnormality is. Of course, the whole idea at that time of this software was to say that can it be used as a screening device, and in the periphery, the software only has to tell us that this is an abnormal fundus and he requires a further examination by a specialist. So at least only limited number of people are then sent to specialists for further evaluation and treatment. The problem with many of these are, like, you may say that there is a 90%, 92% accuracy, but you don't want it to miss out. There should not be many false negatives, because even if it's 92% accurate, but if it misses out one pre-proliferative diabetic retinopathy, the whole idea is defeated, because then that person, because he was told that he's normal and does not have a problem, he might end up with grave consequences. So that's the holy grail of the whole thing. Google, as we know, took up the same project a few years ago. They took images from Arvinda Hospital and Shankar Mitralaya. They developed a software reading fundus images, mainly concentrating on diabetic retinopathy, but their software, their artificial intelligence is capable of doing much more. They also reached the accuracy of 90% and more. They also deployed this AI for screening of large number of population in Thailand. And they also found the same thing, that it's false negative, the image quality, there still has to be somebody on ground to guide the AI as to what needs to be done. So that's about AI in healthcare. What about neuro ophthalmology? Because CVI falls into pediatric ophthalmology and neuro ophthalmology. Where has it been used? And this is a beautiful study which was done by our friend Dan Milia from Singapore. So they studied, they fed over 15,500 images to the software. What was the purpose? They wanted the software to differentiate between normal and disc edema, and then they wanted to differentiate between a papilledema and a non-disc edema related abnormalities. And they found that 87.5% accuracy, 96.4% specificity, and to differentiate between normal image and any optic anomaly, accuracy was even higher at 92%. In this conference, in fact, yesterday in Rangachari's session, there was another paper on AI in neuro ophthalmology, beautifully done from a group from Bombay, where they actually are using AI and another language called Wolfram language, and say that looking at the fundus image, can a software give you a further treatment algorithm and say that this patient is likely to end up in optic nerve fenestration or a shunt procedure. And that's something which we are looking at. So with that background, AI in healthcare, AI in eye, and AI in neuro ophthalmology, let's look at why AI in CVI is required. Because children, there are 19 million people who are visually disabled. Pediatric population require even more training for the screening, and there is a lack of accurate screening tools in the periphery. That's the reason why if AI can pick up the children with visual disability and also can tell.
Carry on, Rashmin. Carry on. Carry on.
So there are two projects that I want to talk about here in CVI. One is Project TrackAI. Now this is being done by a startup called Dive Medical Startup. They are more looking at picking up children with a visual disability. And as we all know, somebody who is below the age of 4 or 5, pre-verbal children, it is extremely difficult to pick up these children who have a visual disability unless the patients are extremely observant or the visual impairment is bilateral and severe. So what does this Dive do? They have carefully designed stimuli on high resolution screen. So they present, and this is their patented software where they present a stimuli to even the small children, pre-verbal children. They use a gaze tracker to correlate between what the gaze tracker data tell you and how a child has responded to a stimuli. And this obviously initially will be done by a trained pediatric optometrist and pediatric ophthalmologist to say that to train the machine to pick up from the gaze tracker children with visual disability. Once the software is ready to say, okay, these are the children who don't seem to have a normal vision, they're not responding to the visual stimuli the way they should. And this pickup, how they pick up is by gaze tracker. And once the machine is ready with saying, okay, these are the children who don't have a proper vision, then they will be escalated for a further examination by pediatric ophthalmologist. What about specific to CVI? Now, children with CVI have a peculiar problem with the vision. It's not only the loss of vision; they have visual deficit, which are more peculiar. Like they have much more difficulty in low contrast, as can be seen when you present the images to the normal children versus CVI children. They will miss if the image which is presented to them has a low contrast. Again, they can have a reasonable response to objects which are moving. So motion sensitivity can be spared, and they have intense difficulty if the environment in which they are moving in, either the image or the real environment, has a visually complex challenges. Then they are really lost. Now, this is the background under which the next model has used. This model, what it will do, again, they'll use a gaze tracking. They will determine the relative importance of features like background, faces, motion, contrast among children in facilitating children with CVI. Again, they'll use a gaze tracker in non-verbal children. They will train with the help of gaze tracker. They will pick up saying, okay, these children are responding to this particular contrast level. These children are responding to the motion. These children are not responding at all. So basically, by screening these individuals, even you need not be a CVI specialist or a pediatric neuro ophthalmologist or pediatric ophthalmologist, even a technician would be able to tell that this child has this amount of difficulty in CVI, and then depending upon that, they can be rehabilitated. Another interesting AI which I came across, this is a thesis from this doctor or optometrist, Dr. L. Fadii, and what they did specific to AI is that in fact, this has already been published in one of the computational intelligence system journal.
Rashmin, I'm going to have to ask you to summarize.
So this is the last slide.
Okay.
So what they have done is they have fed the visual field defect data into the AI, and they have now the machine has learned as to they have created a 3D avatar of a patient, and they have simulated what kind of difficulty a severe patient face when they navigate the surrounding, which may or may not be similar. And from that, now they hope to create an environment for that particular patient using this AI, because AI will tell you that he will be okay if you arrange a room in such a way, he will not be okay if you arrange a room in such a way. And that then will be simulated in a real life. I again thank Professor Malik for inviting me and giving me this challenging topic.